Thank you for taking the time to watch this video about rhinoplasty. Okay, these are your post-operative instructions for rhinoplasty, which is a particular type of nasal surgery, as you already know. Some of you are watching this before you undergo the procedure, and others are going to be watching it after you undergo the procedure. I hope that you'll have watched it before and after so that this information will sink in. This is all the same stuff we covered before surgery. It's also the same stuff that the nurses have gone over with you, but I wanted to make sure that you heard me say it again and that you have the opportunity to watch these instructions and hear these instructions as many times as you feel necessary in order to make yourself comfortable with what is expected after surgery. For a lot of people, surgery can be a really daunting prospect. For a lot of you who have undergone this procedure, you've never undergone surgery before, and so you're nervous and you're concerned about what you need to know about it. Additionally, some of you may have family members that want to know how they can help with your post-operative care. And so I think it would be useful for them to be able to watch this video as well so that you're all on the same page. And if you have any questions or concerns, you have this as a reference, okay? Now, in addition to this video, you'll notice that in your post-operative instructions, you have a sheet that looks like this, okay? It's fluorescent. It may be yellow, maybe pink, maybe green, maybe orange. We vary those colors periodically. And then you'll also notice that you have an instruction sheet that looks like this, that has a whole bunch of different colors on it. And this all have the same information as this video that I'm about to go over with you. They're just presented in 3 different ways so that it's easier for you to choose which way is the best way for you to remember how to do what it is you need to do after the procedure, okay? Now, I know some of you got these instructions in the recovery room and you were kind of groggy at the time and you're not entirely sure what was told to you. That's why we want to make sure this is available to you. And of course, you have our website as a resource. You also have our YouTube channel as a resource. And if you're watching this post-operatively, you also have my cell phone number on those discharge instructions. And that way you'll be able to contact me and text me or email me or call me if you have any concerns that we don't address in this video or that we don't address in the instructions. Okay, so let's go through this one step at a time. So one of the first things people want to know about is pain control. Okay, now one of the things we're trying to do in our practice is minimize the use of narcotics so that patients don't end up addicted to them, but that doesn't mean that you can't take them. And so as a result, you'll notice in your discharge instructions, you have 3 different things that you can take for pain. Now, 2 of them you're already familiar with. Okay, we have ibuprofen and we have Tylenol. Let's start with the Tylenol. As far as the Tylenol goes, you're going to see an image here right now that shows you exactly what we're talking about. I would like for you to use extended release Tylenol every 8 hours. Okay. Now, you also notice ibuprofen is on this list. Now, you're familiar with both of these, but a lot of people may have told you in the past that you should take those and stagger them. And there are some advantages to that, but I would really like if you would take them together. Okay, they don't work the same way, and so they won't interfere with each other. It is safe to take them together, but it's important to remember that if you're going to do that, you do it on schedule, and that way you minimize any risk. And the nice thing about taking them together is that if they're spaced 8 hours apart, then you'll be able to get more sleep. You don't have to wake yourself up in the middle of the night in order to take your medicine. Okay, so again, if you take a look here on this sheet, you'll see the Tylenol is extended release. You have the picture of it in there, and so it's important to take that picture and get the right Tylenol. Okay, I don't want you taking regular Tylenol. I don't want you taking extra strength Tylenol. Take the extended release Tylenol. That's the one that's safe to take every 8 hours. If you take the other stuff, you might run the risk of overdosing, and that can be very dangerous. Okay, so you could take the Tylenol, you could take the ibuprofen together. Do that every 8 hours for the next 4 weeks, even if you don't have pain. Take it regardless. That will help maintain better baseline pain control. Okay, and then you'll only need to take the oxycodone as needed. Okay, you don't need to take the oxycodone around the clock. Just take it as needed. And a lot of people will find that if they're taking the ibuprofen and the Tylenol as I just instructed, they'll need a whole lot less of the oxycodone. Now, for some of you, if you didn't have surgery on the bones of your nose, then you'll find that you may not need any of the oxycodone, and that's okay, all right? But it is important to try to stay ahead of the pain And as you get close to that time when you're supposed to take the medicine, if you're starting to feel more pain, it's okay to take the oxycodone at that point, because if you wait longer than that until it really hurts, then it's going to be harder to get the pain under control. So that's something that's important to keep in mind as well. Okay, so there are a few other medicines that I want to go over with you. Okay, many of you are going to feel like you went home with half the pharmacy in a big paper bag when you go home after this procedure, because you're going home with so many different medicines. So I want to make sure we go over those together as well. Okay, one of the medicines you're taking is going to be an antibiotic. Okay, that might be Bactrim DS, or it might be a different antibiotic. It's important to take that exactly the way it says. Take them until they're all gone. We want to minimize the risk of infection. Okay, so please make sure you take the antibiotics until you don't have any more of them any longer. Okay, two phrases we don't want to hear together are leftover and antibiotics. They don't go in the same sentence together. So take those until they're gone. Okay, you'll also notice there's another medicine called a Medrol dose pack, and that typically lasts 6 days. Okay, now you'll notice on the package it'll say take this many pills on the first day, take this many pills on the second day, take this many pills on the third day. And a lot of people get nervous. They're like, okay, well, how many of them do I take in the morning, and how many do I take in the middle of the day, and how many do I take in the afternoon? If you want to take it exactly the way it says on the package, that's okay. But the other thing that you can do, and I found for me personally when I've had to take this medicine in the past myself, it might be more convenient for you to take the entire day's dose. So let's say it's Monday and it says to take this many pills on Monday, then take all of your Monday pills at the same time in the morning. Okay, there are a couple of advantages to that. Number one, if you take them all together, you're less likely to forget. Number two, if you take them all together in the morning, some of the side effects that it can cause, particularly the insomnia, trouble with sleeping, are less likely to occur, because by the time you're ready to go to bed, some of that has already worn off. Okay. Now, if you're not sure about this, just take it exactly the way it says on the package. But it is okay to take the whole day's dose all at once. I would recommend doing that in the morning, and also doing it on a full stomach, okay? Because if you remember, there are some potential side effects associated with a steroid. There's the potential for insomnia and trouble sleeping. There's a potential for jitteriness associated with the steroid. There is the potential for heartburn. That's why you want to take it on a full stomach, okay? There's also the potential for irritability. And also the potential for just having a whole lot of extra energy. I mean, if you can imagine, this steroid mimics the actions of some of the hormones that your body releases when a bear is chasing after you. And so if you can imagine all the things that might occur to your body when you're trying to run away from a bear, that's basically what you're feeling right now, with the exception of the fact that there isn't actually a bear chasing after you. So don't be surprised by those side effects. They are pretty common. If you are aware of them beforehand, then I think you're less likely to have problems with them, okay? And you'll be able to tolerate that better. Okay, you'll also notice there are two different nasal sprays in your amongst your medicines that you should have taken home. One of them is nasal saline, and the other one is called Afrin or oxymetazoline. Okay, oxymetazoline is the generic name of the medicine, and Afrin is the brand name. You might have gotten a different brand, and that's okay, as long as it's the nasal spray decongestant. Okay, so it's very important to remember that these are two very different medicines from each other. The Afrin is a decongestant. You should use that 3 times a day for 3 days, and then throw it away. That way you don't get it mixed up with anything else. Okay, so you're going to use the Afrin 3 times a day for 3 days. Okay, and then throw it away. As far as the nasal saline goes, the idea behind the nasal saline is that you won't let your nose dry out while you're healing from surgery, because if it dries out, it's going to take longer to heal, and you're going to find you're going to get a lot of crusting inside your nose, which will be uncomfortable, and it'll make it tough to breathe. So the nasal saline will help with the breathing. It'll help with dissolving away some of the crusting that's inside your nose. Some of you will have a gel inside your nose that's called a Stomberger foam. That's also to help with healing. And the saline will help dissolve that so that it comes out in little globs. Some patients have told me it feels like a big booger up inside their nose. That's the technical term, by the way. And that's basically what it is. It's artificial snot, if you want to think of it that way. And as you use the nasal saline, it'll help dissolve that away, which is exactly what we want it to do. For some of you, that's going to come out in little clumps. For others, it's going to come out in one big chunk, and you're going to feel like your brain came out. That's not anything to worry about. That Stomberger foam is supposed to do that, okay? So don't worry about that gel. Just keep using the nasal saline spray. It'll soften it up, and it'll get it out. And if we need to, we'll take it out for you in the office when you come back for your post-operative visit. But the nasal saline, which is different than the Afrin, you're going to use every 2 hours in each nostril while you're awake. Okay, so that's a lot. You're going to use that every 2 hours. So if you're up for 12 hours, then you're going to use that 6 times during the day. Okay, if you're up for 18 hours, you're going to use that 9 times during the day. I don't imagine very many of you are going to feel ready to be up for 18 hours after you've undergone surgery, but some of you might feel that way, and make sure you're using the nasal saline every 2 hours while you're awake. Okay, so we went over the ibuprofen, we went over the Tylenol, the oxycodone, the nasal saline, the Afrin, the steroid, and the antibiotic. Okay, now let's go over your activity restrictions. Number one, most important, okay, most important, do not blow your nose. For 4 weeks after surgery, please do not blow your nose. You can sniff, you can go like that all day long. Okay, that's safe to do, but don't blow your nose, because if you blow your nose, a couple things can happen. Number one, it increases pressure in the face, which will significantly increase the risk of bleeding. And if you end up with a nosebleed after the surgery, there is a possibility you may need to go back to the operating room. So please don't do that. Okay, that's number one. Number two, I did a lot of delicate work inside your nose, and by blowing your nose, you could rip some of that apart. Sorry to be a little bit graphic, but that's the fact of the matter, okay? So if you want to get the best result possible, try not to mess that up, okay? You also don't want to bump your nose into anything, and we'll go over that a little bit in a second here, okay? But those are the two main reasons for not blowing your nose. You don't want to rip anything apart, and you also don't want to cause a nosebleed, okay? A couple other things. When you're sleeping for the next 3 or 4 weeks, don't lay down flat. Okay, when you're laying down flat after this kind of surgery, it'll cause more swelling inside your nose and face, which it'll make it take a whole lot longer for your healing to occur. So make sure that you sleep with at least 4 or 5 pillows under your head, or if you can sleep in a recliner, then great, do that. You'll find that it'll help with the pain, it'll help with the swelling, it'll help with your recovery, it'll help with your healing. It's better for you all around. And that's my recommendation as far as that goes. Okay. You also will notice that some of you have a splint over the top of your nose. Okay. Some people think of it as a cast. Either term applies. Okay. It's important to leave that splint on there for at least the first week. For a few of you, you'll have to leave it on there for 2 weeks, but most of you will only have it on there for 1 week. Okay. How do you know? I will tell you whether or not you need to leave it on for 2 weeks. If I didn't tell you to leave it on for 2 weeks, and if it's not written down to leave it on for 2 weeks, then you'll only need to leave it on for 1 week. But either way, you're not going to take it off. We're going to take it off for you in the office. Okay. Now, if it falls off before you come in for your office visit, take a piece of tape, go across from your cheek over the splint, and then over to your other cheek to hold it in place. That splint serves a few different purposes. Number one, it helps hold everything in position while you're healing. Okay, if some of you may have had this surgery done because you had a crooked nose and we're trying to straighten it out. If that falls off, it's less likely to stay straight. Okay, that's number one. Number two, when you're laying in bed, some of you have a tendency to sleep on your side or sleep on your belly, and so if you lay on your nose after you had surgery, then you're going to move stuff around, and that could mess up what we did. And so the purpose of the splint is to apply pressure to your face when you roll over onto the splint before you have a chance to roll over onto your nose. Is it going to completely prevent you from messing up your nose if you're really determined to do it? No, but it'll put enough pressure on your face that you'll say, oh, wait a minute, I shouldn't do that, and it'll protect your nose well enough to be able to help with that. Having said that, it's important not to bump your nose into anything. So some of you out there are, you're really eager to get back to your regular life, and you want to go play basketball, or you want to play football, or you want to do, kickboxing or whatever. I would recommend don't do that. Okay, don't do any of that until you're cleared by me or by Steve, because we don't want to do anything to mess that up. Okay, the splint is helpful, but it's not foolproof. Okay. It's not like a bulletproof vest that's going to keep you from messing up your nose. Okay, so you'll use that for 1 week, and then We're going to take it off in the office. Okay, remember, we take it off for you. You don't take it off yourself. We will take it off for you in the office, and then we're going to give it back to you. It's important for you to use that splint for the next 3 weeks after the surgery, or 3 weeks after we remove it, that is, while you're in bed. Okay, for the same reason that you had it on before, so that if you roll over onto your face, you have something to protect your nose while you're healing. Okay, it takes about 6 weeks for those bones to set, and so for the first 4 weeks, it's critical that you're using this for the first week all the time, and then for the next 3 weeks whenever you're in bed, so that you protect your nose and help to get the best result possible. Okay, and then the last thing I want to go over is ice and heat. Okay, so you may have been told different things by different people. What I want you to pay attention to is what I'm telling you as it pertains to your surgery that I did for you. Okay, so you'll notice on this sheet right here, okay, there's a blue box right down here that says ice. Okay, you can use ice on your nose and your face for the first 48 hours. After the first 48 hours, switch to heat. Don't use ice any longer. Okay, some of your physical therapists or some of your other surgeons or doctors may have told you, oh, alternate between heat and ice, or it's okay to use ice as long as you want. I would recommend against that as it pertains to this particular surgery, and I'm going to tell you why. Okay, the way that ice works is that it causes what's called vasoconstriction. It causes the blood vessels to clamp down so that it decreases blood flow to that area, and that way you get less swelling. And the other thing that ice does is it gets the nerves to kind of numb up a little bit so you don't have as much pain. And those are advantages in some respects, but I want you to understand what my perspective is on this, okay? So when you apply the ice for the first 48 hours, that's important to help you with your discomfort. But after that, I want you to apply heat, because the heat causes vasodilation, causes those blood vessels to open up, which increases blood flow. It increases oxygenation. It increases nutrition. It speeds up healing and will in turn help with your swelling, not because it's doing anything to the fluid, but because it's helping you heal faster, okay? We don't want to do anything that will impair your healing. And so ice for the first 48 hours is a reasonable compromise, but then after the first 48 hours, it's really important for us to improve your blood flow, and the best way to do that is with heat. When it comes to the ice or the heat, do not apply it for more than 20 minutes every hour, okay? So if you're going to do it every hour, which is okay to do, make sure you only leave it on for 20 minutes and then wait until the next hour. Okay, so make sure you have a clock or a stopwatch or something with you that'll remind you not to put it on there for too long, all right? Again, as we talked about before, take a look at your instruction sheet, that one or this one, okay? Whichever one you are most comfortable with. For some people, like I said, it's easier for them to hear me talk about it, and you can watch this video as many times as you need to. For others, you'll find it easier to read your instructions off a sheet of paper, and you'll understand it best that way, and that's okay. And then for others, you'll find that it's easiest for you to understand it when you're looking at a graph like this. You have all three resources available to you, and then of course, as I mentioned, for those of you that are already post-op, you'll have my cell phone number, and you'll see that cell phone number is at the bottom of that fluorescent sheet. Don't be shy. Text me or call me if you have any questions or concerns. Okay? Please be safe out there, and let me know if you have any questions. And I look forward to seeing you again in the office.